If my life was Disney, Retina would have definitely been my Rapunzel. And this video is about saving her tangles from the jaws of incarceration. A worrisome situation caused usually by trauma, in my cases were caused iatrogenically by two different subspecialties of ophthalmology. Presenting Management of Iatrogenic Retinal Incarcerations, Rescuing Rapunzel. My first case came from a retina department where an attempted scleral buckling for pediatric retinal detachment caused a superior scleral perforation with retinal incarceration. Surgery began with core vitrectomy and peripheral vitrectomy. SRF drainage through superior brake delineated the incarceration adjacent to brake with retinal folds radiating from it. Further PVD was attempted to have a tractional pull on the retina. This traction had to be very careful so as to avoid ripping open the causative brake. After repeated, careful and very slow traction on attached vitreous from suction of cutter, we can see my tangled Rapunzel getting released and freely fluttering. It was followed by fluid air exchange and endolaser of brake and perforation site, which can be clearly seen in yellow. Followed by 360-degree endolaser circlage, followed by silicone oil injection. At 3 weeks, patient's vision improved from PL positive to 6/60 in an oil-filled eye with normal IOP. Second incarceration came from anterior segment where a peribulbar block before cataract surgery caused a paramacular scleral perforation with retinal incarceration. I proceeded with core and peripheral vitrectomy to clear the vitreous bleed and visualize the retina. The incarceration was pretty obviously visible here. Because of its proximity to fovea, a tractional release like previous case had a risk of macular rip. Hence, here the edge opposite to macula was diathermized and carefully suctioned with cutter, without cutting, which led to fraying away of the cauterized retina. Thus giving me my untangled Rapunzel, and here you can see her edges freely fluttering. It was followed by fluid air exchange. Next challenge was to deliver extremely precise laser to the macular edge so that not only the fovea remains unlasered, but also the expansion of laser reaction post-op spares that vision giver. It was followed by 360-degree laser circlage and silicone oil injection. At 2 weeks, patient improved from hand movement to a 6/60 in an oil-filled eye with normal IOP. And this, ladies and gentlemen, was how I rescued the love of my life.